Hey there, it's Dr. Sarah here. Today, on the She Found Motherhood podcast, I have the pleasure of chatting with Shannon Smith. Shannon has over 10 years' experience working as an eating disorder nurse, and she now works to help all women looking to heal their relationship with food and their bodies. She's a certified intuitive eating counselor and a graduate student in counseling psychology. We'll get into our conversation around body image and intuitive eating right after this quick message.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Good morning, Shannon, or perhaps I should say good afternoon to you.
Good afternoon.
Welcome to the She Found Motherhood podcast.
Thank you for having me. I'm thrilled to be here, and I feel like this conversation has been a long time coming. And
I know. I'm thrilled to have you here. I just wanted to start by asking you to introduce yourself. Tell us a little bit about who you are, the work you do, and how you got into this work.
Okay, so my name is Shannon Smith. I live on the east coast of Canada, the opposite coast to you, Sarah. I live in Halifax, and I've been doing this work for about 15 years within the healthcare system. So I started off as a mental health nurse on an inpatient psychiatry unit working with the general psychiatric population. So depression, anxiety, schizophrenia, bipolar, you name it. But we always had one or two patients with eating disorders on the unit, and I would just gravitate to those patients. And then within a couple of years, I was working with the eating disorder program exclusively, still in the inpatient setting. And so that's what I did until June of this year when I made a bit of a pivot. But really, what I'm doing is extending my reach because I've known for a very long time that you don't have to have an eating disorder to really struggle with your relationship with food and your body. And I think there are so many people who don't know where to get help for that unless they have a diagnosable condition. So I wanted to be one of those people. And so that's when I started the certification process for intuitive eating the beginning of this year and became certified in June, left my inpatient job to really focus on developing my own private practice around that. And I am also a graduate counseling student as of last year. So I'm a master's student as well. Yeah. So it's a bit of a career shift, but it's in line with everything I've always done.
Oh, that's awesome. Yeah, it's so prevalent. And before we started recording, we were talking about really how much like body dysmorphism and people who have really problematic relationships with food is out there. And I think pregnancy is a time that could probably amplify some of these symptoms for people.
Absolutely. I was thinking about that. We are all undergoing changes with our bodies. I think a lot of people have experienced accelerated change in the last 2 years with COVID.
Yeah.
So this conversation has become more relevant, actually. Diet culture has responded with increased pressure and increased messaging. And so I think pregnancy, though, is another time of accelerated body change.
Yeah.
It's just condensed within those 9 months. And there's really no stopping that train. And so I think for women who have maybe had a history of avoiding their body or engaging in other sort of negative body image perpetuating behaviors like body checking, body comparison, they can't do the body avoidance thing anymore. So it's just really in their face. And so in thinking about that, on the one hand, it's a huge struggle for women during that time. But on the other hand, it's a huge opportunity as well to really start to do that healing work around food and your body because you can't escape.
Yeah.
So
Yeah. Maybe we could start by just outlining for people who might not know what to look for in terms of if they have negative body image. What kind of symptoms or behaviors might people be doing or practicing that they don't even realize are actually beyond the realm of like normal image?
yeah. So one of the most common ones is body checking. So hopping on the scale every day or multiple times a day for some people, that's one form of body checking. Pinching your body in certain areas, checking to see if you have a muffin top or if your body has changed in certain ways. So, in a sense, you're measuring your body by doing that kind of a behavior. Just looking in the mirror, like obsessively looking in the mirror at different angles. And then there's body comparison as well, which is comparing to obviously other women, other people, comparing yourself to people in your social media feeds, comparing yourself to your former body. So that happens a lot in pregnancy as well. Look at my body compared to pre-pregnancy. Will I ever get that body back? Or like when they were younger. So I'm 40. Like a lot of women my age are, you know, trying to uphold a standard that was manageable at 25, but at 40 with shifting hormones and just life in general getting to be so chaotic, like it's really not attainable. It's not, and it's not healthy. So that's the body comparison, just to keep things really simple. And then body avoidance is where kind of the other end of the spectrum from body checking, where it's you don't want to look in the mirror, you avoid mirrors, you avoid the scale, you wear it's like some women wear really baggy clothes because they don't want anybody to comment on their bodies or to be looking at their roles or certain things like that, where really they would love to wear more stylish clothes, but it's just too scary to do that. So those are some of the common behaviors. And then there's also the negative self-talk. So really starting to pay attention to what are the thoughts? What is that internalized diet culture voice saying to you on a daily basis, moment by moment? All of those shoulds. You should be doing this. You shouldn't be doing that.
Mhm.
Yeah.
Yeah. Oh, that's so powerful. And those behaviors, I'm sure all of us at some point in our journeys with
Mm.
our bodies and as they change. And especially, I have had 3 pregnancies, and it's crazy how our body changes. And it's never going to go back, right?
No,
Quotations here on our video.
it really doesn't. And if I could just interject there, I think it's a surrender process to actually accept that your body's not going to bounce back and as our culture expects it to. And that's really painful. It's a really painful process for women. It involves a lot of body grief. And so just like the grieving process that we're all familiar with involves several stages before you get to acceptance, and there's sadness and there's anger and there's bargaining, and it's part of that process. It's the same sort of thing. It's tough to go through, especially in pregnancy when you're also dealing with being tired and maybe feeling sick and like having other children like that need care and all of that. Yeah, yeah, I
Yeah.
definitely have a lot of empathy for women in that position.
Yeah. And you touched on it that social media, and I think we're doing a better job. And when I say we, I just mean as a society and a culture of normalizing what the postpartum body and journey actually looks like. But it's still, there's a lot of that sort of negative bounce back talk and imagery out there.
Yeah, absolutely. And I think that's one of the remedies for that body comparison habit is really looking at your social media feed. What are the images that I'm paying attention to? Not only paying attention to, but conditioning myself with mentally every single day. Am I engaging in that bounce back culture because we're really wiring our brains. Like when we talk about neuroplasticity, just how certain messages just get deeper and deeper into our brains and harder to break. Social media feeds are huge for that. So that's one of the first steps that people like to take is going through and how does this image, how does this account make me feel and really checking in. And then also deciding to follow the people who are promoting a more positive image of realistic body change with pregnancy.
Mhm.
Yeah.
Yeah. I was going to ask you, so I'm glad you started to go there. So, for people who are listening that might have some of those symptoms and notice themselves doing those behaviors, what are some steps and strategies? So, you mentioned, love that one. And I think I'm going to do it myself, going through social media and maybe unfollowing accounts that make you feel like that you find doing that checking and that. But what other things would you recommend people do?
Yeah, so that's a big one for the comparison piece is paying attention to what you're looking at and then also paying attention to your self-talk when you are comparing because it becomes this kind of inferiority superiority complex. So sometimes we end up on the, superior side of that comparison. And that can give us like an initial hit of, oh, like I feel good. But when you're on the opposite side, that feels really awful. So when you see somebody and you notice yourself feeling superior, it's looking at that person and maybe you do have judgments about their body size, but really like peeling back that outer layer and trying to recognize things about them other than their appearance. That's going to condition your own brain to recognize things about yourself other than your appearance. So that's in sort of the body comparison box. The body checking piece, getting rid of the scale is huge. The scale, it's intermittent reinforcement of negative body image. So sometimes you get on and it's like, oh, great. But it's few and far between for people, right? So most of the time, let's say you do that 20 times in the run of a month. If like you're getting 2 times where you're like happy with yourself and 18, you're not really doing some psychological damage there. And also, I think there's some psychoeducation that needs to happen here as well, or just education in general around health, what actually means to be healthy, and how health is not tied into weight, it's not a behavior. So, measuring your weight on a scale isn't really giving you any valuable feedback about your health behaviors. So, knowing that's a really big one, easier said than done to get easier said than done. But I do think the first step is awareness. Oh, catching yourself like pinching your body or trying to hide your body or avoiding mirrors and just really starting to notice with compassion, with a sense of curiosity instead of judgment, because you don't want to turn this into something else to feel bad about. But it's just, oh, I'm doing that a lot. And then asking yourself, how does that actually make me feel? And then considering your values as well. Is what I'm doing here, this pattern of behavior, is it aligned with my values and how I want to live my life? Or is it maybe aligned with diet culture values that have become just part of you and you don't even really realize until you start to really pay attention? So those are a few things. Journaling is another great one that is accessible honestly to most people. So if you're having a really crummy body image day and you're starting to recognize I feel awful. So a lot of people will say, I feel fat. Fat is not a feeling. Fat is not an emotion. And I try to minimize the feeling of feeling fat, but with body image, what's so fascinating is in the same 24 hours, you can feel fat and thin. Right. And
Totally.
because because body image is not actually about how your body really looks. It's your image of your body. It's how you feel in your body and how you feel moving your body, just how you perceive all those things. So when you say, I feel fat, number one, catch yourself doing it. How often are you saying that to yourself? And then going beneath that, because that's superficial, right? That's not a real thing. What is the actual emotion underneath that? What are you actually feeling? Is there some body grief there? Is there some sadness, some frustration, some despair, some helplessness, hopelessness? Is there internalized weight stigma that like you're trying to grapple with being in a larger body in a world that doesn't support you in that? And so just picking up a journal, just putting pen to paper, you can write at the top, I feel fat, and then write, what am I actually feeling? And just free association or like writing onto to paper and letting those emotions come. I'm a big proponent of a good cathartic cry. Like
Totally.
it's so healing. It's so healing for people. So getting to that place, it's a good starting place for a lot of people. Yeah, to journal, because what it does is it gets you out of that knee jerk reaction into gaining some insight as to what thoughts you're actually having, and then maybe starting to challenge those thoughts. That's one way to go about it. So that's like the cognitive behavioral therapy way. And then there's like another way, which is more geared towards acceptance, and it's acceptance commitment therapy, where sometimes it's hard to challenge those thoughts because they are so conditioned. If you think about when was the first time I had a negative body image thought, for a lot of people that goes back to like early childhood. So there's decades of momentum behind it. And so for some of those people, it's easier to, we call it diffusion, but it's really detaching from the thought. And the way you do that is you recognize the thought, number one, and you label it and you say, okay, let's say the thought is, I am fat. Instead of just allowing yourself to keep thinking, I am fat, you say, I am having the thought that I am fat. So that creates a little bit of distance, a little bit of space. And then you can start to challenge it further and say, okay, how old is this thought? How long have I been thinking this? How many years or how many days, years, decades has this had the chance to gain momentum, like the snowball going down the hill? And then how is this thought serving me? Or is this thought serving me?
Mhm.
And so again, it's awareness, but for some people, if they can't replace the thought, it's just, okay, this is a residual thought. You can label it actually as neurological junk. Um, neurological junk, because again, neuroplasticity, there's going to be these things that just keep playing like a record player. And it's like, where did this even come from? And they're just going to float around in the back. And I think that's especially useful in pregnancy, where like, you're wanting to grow your baby in the most peaceful way possible.
Mhm.
And sometimes it's too much to try to like reverse the way you feel about yourself or get to body love. Like body love is such an elusive concept for most. You're wanting to grow your baby in the most peaceful way possible.
Mhm.
And sometimes it's too much to try to reverse the way you feel about yourself or get to body love. Like body love is such an elusive concept for most people, right? So
Mhm.
it's really more about moving towards body neutrality and just knowing, okay, that those thoughts are going to float around in the background, but they don't have to dictate my actions, and they don't have to induce my engagement in actions that don't align with my values.
Mhm.
What are my actual values here? And yeah, I know that was a long.
No, I love it.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
I'm super into CBT and changing thoughts. And so I can't think of a good example, but I'm sure you'll be able to. And one of the things I've heard is you can't go from like, I feel fat or I hate my body to I love my body. So you do mini steps like thought swapping. Instead of saying I hate my body, say, I can't think of a good next one.
but I can help you with this. So one of the things that we do, this is highly, it's fascinating, but it's also like really difficult for people. So one of the things I've done as an eating disorder nurse in my one-on-one therapy with patients is mirror exposure. And that's really for the symptom of body avoidance. So having somebody stand in front of a mirror for 20 minutes in form-fitting clothing and go from like head to toe and look at every part and start to shift towards body neutrality.
Yes.
And I've done this like in the room with people. People can also obviously do it on their own too. It's not for the faint of heart. But so for
Me doing this for 20 minutes.
it feels like an eternity. Yeah. When I start with 5 minutes, even start with this is just what we do in the clinical setting. But so, let's say the person, like my belly is disgusting. And they just have a really harsh, negative thought that comes to mind. They speak that out loud. And then they just work on reframing it to a neutral statement. My belly is soft, but like my kids love to rest their head on my belly. And just going head to toe that way. And then what we do after that is we go toe to head, we go back up, and they start to reframe in terms of the function of their body and just really appreciating my thighs are whatever. And just my thighs are strong and they support me and they have this. So it's function over form. I focus on that. But yeah, that the whole body idea is really tough. Like 80% of people have body dissatisfaction. That's really well supported by studies. And then when you consider that like over 60% of women at any given time are on a diet and really just reinforcing that negative body image, it gets really hard to treat. But yeah, so it's more about body neutrality. It's just a more realistic goal.
Yeah. And I love that. And I'm going to use it on myself. I do that sometimes that, like I remind myself, because my body has changed so much since having 3 kids. And I do that. My kids love my belly to sit and snuggle on it. And you have to remember there's so much positive. And what's really fascinating, and my husband always says this, is that, and I think actually I did a podcast a few weeks back with a fertility physician and saying the picture of health and beauty 100 years ago was very different than it is.
Exactly. And that's what's so maddening about diet culture is it's a shapeshifter. It's always shifting. And when you consider like the advice of diet culture to like avoid this, and then 10 years later, it's no, eat lots of that and avoid. And then, the beauty standards like 15 years ago, it was like, a stick figure, like, like rail thin.
Yeah.
And now it's no, you want the booty and you can't win. And so it's just recognizing how neurotic diet culture is. And do I want to continue to participate in this? Because it's just, you can never make diet culture happy or yourself happy when you do.
Yeah. And I really liked how you tied all that conversation into your values, right? I think understanding your personal values and your family's values are so important, and it can really help you shift perspective and what is important to you, whether that be in your life, in your work, in your body image, right?
Mm-hmm. Yeah. And it's a huge consideration when we go back to like women who are pregnant, because I know you work with a lot of pregnant women, and we were talking about that. It's a really great time to start to give some thought to that too. It's okay, like I'm bringing this child into the world. Like how do I want to model a relationship with food and body to this child going forward? And this is a great time to start. So what kind of messages do I want to not only speak to them, but demonstrate to them? Because kids pick up on all that stuff. As discreet as you want to try to be in going on a diet, or here's the other thing with dieting is people sometimes nowadays don't even recognize they're on a diet anymore, because there are diets by many names now, like wellness and diet culture has become really entangled. So it's considering all of that. Being a healthy eater is not just eating a healthy balance of foods, it's having a healthy relationship with food too. So if you're missing that whole piece of the puzzle, that's pretty huge. And kids do pick up on that. And there's no question, especially because they're such concrete thinkers. So if you're perpetuating this notion of black or white thinking or good and bad foods, they pick up very quickly, and then they start to internalize that themselves and like, okay, if I eat this food, it means I'm bad. If I eat this food, it means I'm good. And so we have to be really aware of that and know that it's not benign. Like it does cause harm and to kids and to ourselves.
Yeah,
So
absolutely. Actually, I think this would really nicely transition us to for you to talk a bit more about intuitive eating. I don't know much about it. I know
okay.
about intuitive eating from like the infant perspective,
Yes. Yeah.
but I would love to hear what you've learned and
Sure. So the whole concept of intuitive eating, it's so funny because I've been an eating disorder nurse, like I said, for almost 15 years, but I really just like intuitive eating, the framework came on my radar about 2 years ago, just kind of crazy, but it's definitely like gaining some momentum in social media. But I do need to let people know the social media version of intuitive eating is far different than what intuitive eating actually is. And that's the case with most things on social media. Yeah, so that's a great place to start, Sarah. The infinite version of intuitive eating. So I think of lowercase I, lowercase e, like intuitive eating is our innate ability to feed ourselves. When you lay a brand new baby on in their mother's chest, like it's pretty crazy to there have been studies done on babies being able to wriggle their way up to the nipple and
up there and up on the boob.
they do. They do. And so that's an innate ability. And if it's not messed, it'll stick around. And so the thing that gets in the way is diet culture. So what intuitive eating, like capital I, capital E, the framework that was developed by two dietitians back in 1995, but is really just starting to like really gain momentum now, was a way to return people to that innate ability. And so it's an undieting process. It's a self-care eating framework that has 10 principles. The ones that you see on social media most are make peace with food and honor your hunger. So then people, they have a very incomplete understanding of what intuitive eating is. And they get scared because they're like, I give myself unconditional permission to eat. We're not going to stop eating and all of this, but they're not factoring in all of the other 10 principles, which are like feel your fullness, reject the diet mentality is the huge one, because that really perpetuates, that loss of control eating. Really, there's something called the restriction pendulum that is going to swing. So like the more you're restricting, the more biologically your body is going to respond to that restriction with deprivation backlash. And it's not just physical deprivation, it's also psychological deprivation from food. So that's a principle. And then there's challenging the food police is another whole separate principle, which really gets at that internalized diet culture voice, like starting to be aware of what food rules have you internalized and are you following. And then there's one all about satisfaction, discovering the satisfaction factor in food, which relates to both ends. So it's not just about having all the foods that you want. It's also, you know what, it doesn't feel good to overeat either. So it's looking at, is this experience with food pleasant or unpleasant? And so there's that as well. And then there's a whole principle around coping with your feelings with kindness and developing other coping mechanisms. There's one on body respect. And so all the body image stuff that we were talking about earlier. And then at the end, and they leave it to the end for a reason, is redefining your relationship with exercise and starting to engage in movement that is joyful and doesn't feel like a chore. And sometimes people need a break from the exercise first. Again, with the pendulum, you have to like swing it the other way to come back to somewhere in the middle that actually is reflective of authentic health and not diet culture's definition of health. And then in nutrition, same thing. So it's honoring your health with gentle nutrition. It's not this like forced restriction. It's really about taking into account actual guidelines, actual nutrition guidelines.
Yeah.
Because the thing that blows my mind and I find really striking is that somewhere along the way, we've equated dieting with health.
Yeah.
And we think if the only way to take care of our health is to be on a diet, and it's so far from the truth. And so with intuitive eating, a common misconception is, okay, that's unhealthy because it's not dieting. It's actually no, like you got to look at the like what dieting actually getting you to do, and is that healthy? And in vast majority of cases, it's not when you really look at it, because because of the way that the body fights back, and because like the body's responding to restriction as famine. So it gets harder and harder to maintain a diet, which, so if you're, and see, people think it's about willpower. It's not about willpower. It's, and they blame themselves when they quote unquote fall off the wagon, but really it's, you can't override your biology. So it's looking at all of that, and it's okay, like, to maintain this diet, these years of chronic dieting, I'm getting more and more obsessed with food.
Wow.
And I'm neglecting these other aspects of my health, my mental health, my emotional health. Yeah. Anyways, again, I could go on and on and on.
Oh, and it's not eating. And it's so true. Like that intuitive eating piece, you see it in children, right? Like a big thing I see for those of you who have toddlers, school age and beyond kids, I can't remember the culture I grew up in. I don't remember. It's like the clear your plate,
Yes.
eat everything on the plate. Whereas we do, like, my tummy's full. Like they'll eat half a cookie and then and that's intuitive eating.
It is.
But we can hammer it out of them by saying,
Mhm.
you
Mhm.
finish what's on your plate. And they're like, but I'm full. And it's challenging, but
It's very challenging. And I absolutely grew up in the clean your plate club.
yeah.
I'm definitely a child of that era. And it's really, and all the knowledge and experience I have, I still find it challenging because I was conditioned for
Yep.
years to like not waste food.
Yep.
And yeah, so it's reversing all of that learning, the learned behavior, and thinking of the consequence of telling a child like to keep eating when they're saying they're full is, it's like planting that seed for distrust in their body.
Yeah.
It's, and also planting a seed for, okay, like pleasing the parent. It's okay. It's more important to please
Yeah.
my parent than it is to really listen to myself. Yeah. It's something to be really aware.
We could go on and on.
I know.
Well,
I know.
it's been an absolute pleasure. I wanted to ask you earlier, we were talking about the symptoms and then some of the steps you could take and the social media. Many people who are listening to this podcast probably also follow us on social media, and we'll share your handle in our show notes. Do you have any other accounts that body neutrality, body positivity that you really find helpful for people that you might recommend?
I do. I do. I would say follow the woman who wrote the book on it for sure. So Evelyn Tribole has an incredible intuitive eating account. And that's the other thing about intuitive eating. It's evidence-based. So there are over 150 studies that back it already. And yeah, we have evidence. That's great. And the other person I would recommend is Christy Harrison. She has a book called Anti-Diet, and she is a journalist turned nutritionist. And interesting, she was doing journalism. It was about nutrition as well. So researched. There's thousands of citations in that book, but her Instagram as well, Christy Harrison, and both of their websites are fantastic too. Also, Christy has a podcast called Food Psych, and it's fantastic. Yeah.
Awesome. Some great resources for people. Thank you, Shannon. And if people wanted to find you or get in touch with you, how would they do that?
Probably the best way is my Instagram. So I'm under Top with Shan. And from there, and my website is shannon-smith.ca. Those are the places that have the
Spend the most time.
Yeah, I spend most time on Instagram for sure.
Awesome.
Yeah.
Awesome. Thank you so much for this conversation today. I am sure so many people are going to find a lot of validation, reassurance, and maybe are able to take some positive steps to body neutrality and a better or an improved vision of their health and wellness.
I hope so. Thanks, Sarah. Thanks for having me.
Oh, total pleasure.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.